I was not too sure that how slow and how descriptive I should be. I was trying to explain line by line, thinking that probably this is the first time you are hearing it. But I was amazed in last 24 hours. Most countries know this recommendation by numbers. And some of you were telling recommendation number 4, this is what we are going, and I was looking at recommendation number 4, what is that about? So your preparation and your work is compelling me, is challenging me to give you different perspectives. So this presentation, I completely changed because what I heard in last 24 hours. The at least three things that I heard, and now I can retire very happily. The first thing I heard, which it's rare to hear this, and I heard here in this meeting, is some of the countries said that we should levy or duty cigarettes to fund these commodities because it makes such a difference. And that was very, very powerful statement that I heard after many, or maybe the first time I heard in the last so many years. The second thing I heard, that we always hear a complaint that we don't have information system. Look at my country, we have done the whole up to district level, whole system computerized, and we get information from district, and we are one of the developing countries, so it's not something that is easily available. From district level to the central level, we have computerized warehouse control system. I think the challenge is from district to the peripheral level, and that's where we are working. So recommendation is how do we go from district to the community level, which is a small distance than coming from all the way from there. And third thing that also kept me very happy, and we were trying for so many years. Some countries said, listen, we are meeting with our regional countries because our issues are common. What we are trying to do now is to have some kind of common quality standard, common regulatory standard, so that we don't have to submit a separate dossier to the manufacturer for the registration, and it takes delayed, it goes on. And we can have a common regulatory system, so you don't have to test in every country and have different standards when you test it. So those are the things that will make these recommendations more practical. So I will not go the recommendation by one, but these are the three things were very outstanding. Now, some of the common thing that we heard that how recommendations are being translated and being discussed. I think the issue of finance came very loud and clear, and many countries said that we need financing. Not financing only for from the external to country, but we need financing because we are decentralized. So we have many states or provinces where the money has gone, and we need to have a full procurement system, or we have to give more financing to the provinces level so that they can be able to buy it. They can buy direct, or we can buy as a pool procurement. Always in these medicines and contraceptives, that's my experience.
Madam Chairs, Honourable Ministers, all protocols observed. My task today is to, particularly for the Minister's benefit, but also for many of you in the audience, is to outline some of the ways in which we as a global community, and particularly the Commission and the follow-up to the Commission, can help to support in the various avenues of support that we're planning, and hence how the work that you've been doing today and the presentations that we will hear, how they will feed in and be very useful for the partnership that Jagdish just outlined. So I just want to outline three main ways in which we are planning to continue the collaboration and partnership at all levels, but in particular the focus on supporting countries and the mechanisms through which we plan to do that. The first will be to work at the both at a national but regional and global level to look for these opportunities for getting the prices and the quality and the packaging and presentation of these commodities to another level. We already have seen in New York the first fruits of this sort of collaboration and partnership with the announcement of the cuts and 50% cuts and the cost of contraceptive implants as one of the first fruits of the kind of collaboration that the Commission is nurturing, and we want to work very hard with yourselves to identify other critical commodities, some of which have price issues, many of which have quality issues, as well as packaging and presentation issues. So we really want to bring the best groups and the best expertise globally to bear fruit on some of the challenges which can be tackled perhaps more at a regional and global level than just at a national level. The second area that we would want to strengthen the processes that are going on and that we've been listening to and you will hear today is around to, as Jagdish outlined, there are many, many barriers and challenges that we're facing with these critical commodities, but there are also very many innovative solutions going on in countries which quite often many are not aware of. So the second role that the Commission and the follow-up and the Commission will play and can play is to nurture the sharing of innovations and solutions, and also think about the scale-up and help to support yourselves and provide technical assistance in thinking through and costing not just the barriers and the bottlenecks, but also the solutions that may be applied, so that you have a better sense of the cost and the benefit ratios, but also that when we talk to donors and your ministries of finance, perhaps more importantly, we have very scientific, evidence-based, costed plans which are focused on good data and real evidence from the ground, legitimized by the best global technical groups that we have. So the second part is really to strengthen your capacity and case to be made to the ministries of finance and to donors for plans and particularly innovative solutions that are going up and scaling them out. The third area which we've identified that could really be added value to what is going on is the one around monitoring and accountability and peer support to measure and help to identify where we're succeeding, to celebrate success, not just at the national level, but at the regional level, but also to share and find solutions where progress is not as fast as we would like. So a third area that we will definitely be working with you on is helping and supporting these networks that are being set up, and already today is one of the first manifestations. So we in the Commission and many of the people here and many of the agencies and including the UN as well as outside of the UN are really coming together to support your efforts, and I've just identified three of the major ways in which what you're going to be presenting and what we're going to be hearing this afternoon will enrich and strengthen the partnership at all levels, global through to national as well. Thank you.
Thank you so much, Mickey and Jagdish, for bringing us all up to the same place in terms of the progress that has been made through this remarkable mechanism that the Life-Saving Commodities Commission has become. It's now an opportunity for us to benefit from the insights of the political leaders who are playing such a central role in ensuring that the hopes and aspirations of the Commission become a reality on the ground for women, men and children across the world. And I think we can start with the Democratic Republic of Congo, if this is acceptable to the Honourable Minister. Thank you, sir.
Merci. La République démocratique du Congo s'engage à la réduction de la mortalité maternelle et infantile. Nous venons d'élaborer un plan d'accélération de la réduction de la mortalité infantile qui est de notre plan de développement sanitaire. Et Nous avons des lignes budgétaires en rapport avec les commodités en ce qui concerne la mortalité maternelle et infantile. Je vous remercie.
I think we just have we have translation available. Petit Chant. Un problème?
À l'élaboration d'un plan d'accélération. Et ce plan fait partie du plan national de développement sanitaire. Nous avons aussi dans le budget à partir du budget 2012-13 des lignes budgétaires en rapport avec les commodités qui contribuent à la réduction de la mortalité maternelle et infantile. Et nous sommes fortement engagés parce que nous sommes conscients que si au niveau de la République démocratique du Congo, du Nigeria et de l'Éthiopie, s'il n'y a pas d'efforts exceptionnels qui sont faits, nous allons traîner toute l'Afrique centrale, à toute l'Afrique, sur la réalisation des OMD 4 et 5. Je vous remercie.
Merci. Très gentil. Thank you very much, sir. I believe, if I take my alphabet correctly, that Ethiopia is where we're headed next. Ethiopia. Yes. Thank you very much, sir. Beg your pardon.
Okay. Dear Honorable Ministers, Commissioners and Delegates, developmental partners, and invited guests, I would like to express my heartfelt appreciation to the Nigerian government and the UN Commission for showing commitment to reduce maternal and child morbidity and mortality and enhance maternal and child health through strengthening the supply chain management system. We recognize maternal and child health problems and high maternal and child mortality in our nation. And recalling the commitment of Ethiopia to various regional initiatives working to improve reproductive health services, taking actions to the recommendations of the Commission on life-saving commodities. We, the government of Ethiopia, is committed to strengthen mechanisms that promote implementation of recommendations proposed by the Commission on life-saving commodities for women and children. Specifically, we commit to scale up the availability of institutional delivery and skilled birth attendants at every facility, expand coverage of life-saving commodities identified in the Commission's report in the maternal, newborn, child and reproductive health, address barriers to access and use of life-saving commodities in the country, strengthen monitoring and evaluation and accountability in relation to the reproductive health interventions and outcomes, work with local and global developmental partners, including local and community leaders, to raise awareness and create demand for prompt healthcare seeking behavior and build capacity of health workers and strengthen public-private partnership. And as a strategy, we're going to use a capacity building activities, collaboration with developmental partners, support local community, commodity producers, strengthen the pharmaceutical fund and supply authority or agency of our nation and the regulatory body. And we will also regulate the monitoring and evaluation, including the independent evaluation, monitoring and evaluation services. As a remark, we are here to save mothers and children. Mothers are dying to give life, and children, newborn and children are dying, struggling to life. Our efforts should be beyond SI. And united we stand, divided we fail. We should have to strengthen regional and continental integration to develop Africa's health system. And Africa is the origin of humankind. Let's make Africa safe to life and livelihood. God bless Africa and the world. Thank you.
Thank you, sir, for that inspiring statement. And now I think Sierra Leone. Monsieur.
Madam Chair, colleague, cabinet ministers of health, other officials on the high table, development partners, colleagues from the respective countries here, distinguished ladies and gentlemen, I want to say hello and I thank you all. I bring you greetings from Sierra Leone. This is the government statement at the implementation meeting of the UN on life-saving commodities for women and children here in Abuja. Under the political dispensation, under the Agenda for Change political dispensation in Sierra Leone, there has been a steady improvement in the health indicators in the past 5 years. In 2005, the maternal mortality ratio was 1,500 per 100,000. And this dropped to 857 in 2008. The under 5 mortality was 286 per 1,000, and this dropped to 140. Although we have seen this reduction, the indicators are still unacceptably high. With the coming of the Free Healthcare Initiative of His Excellency the President in April 2010, we have seen a dramatic increase in the number of people accessing health services at all levels. The determination of government to ensure access to quality of care at all is demonstrated by the following. One, the political and policy commitments. A solid policy platform and political commitments for the repositioning of reproductive health, including family planning, is already in place. This includes availability of several policies and strategies, the implementation of which the government of Sierra Leone is committed to. Two, financial commitments. The government of Sierra Leone is committed to increase the annual health budget from 8% to 12% by 2013, and gradually increase thereafter as the national revenue increases until the Abuja target of 15% is achieved. The government of Sierra Leone has activated the budget line of US $165,000, which is in our local currency 700 million, for RCHCS family planning in 2012 for the first time ever. The government of Sierra Leone is committed to increasing family planning budget line from 0.42% in 2012 to 1% by 2020, recognizing that this will be 1% of a projected increase in budget for health overall. The government of Sierra Leone, securing additional finances for RCH, including family planning and all other RCH interventions through partnering with donors. 3, delivery of program commitments. The government of Sierra Leone is committed to scale up the following initiatives in collaboration with its development partners. 1, strengthening the procurement and supply chain management through operationalization of the National Pharmaceutical Procurement Unit. Improved logistics management, information enhancement of the capacity of staff, procurement of equipment, multi-sectoral collaboration, and use of M-Health for monitoring and accountability. The government of Sierra Leone, secondly, is committed to supporting community outreach for RCH integrated services, including family planning and services for adolescents and young people. And 3, the government of Sierra Leone is committed to supporting the extension of the performance-based financing scheme to cover accuracy of reporting of stocks for the life-saving commodities. I thank you.
Thank you very much, sir. And now Tanzania and Zanzibar. Thank you, sir.
Honorable Chairperson, my fellow ministers, representative of development partners and organizations, distinguished delegates, ladies and gentlemen, good afternoon. On behalf of the United Republic of Tanzania, and on behalf of my delegation sitting there, I would like to take this opportunity to thank the federal government of Nigeria for the warm welcome received. We applaud the co-chair of the Commission, Nigeria and Norway, UNFPA, UNICEF, and all parties concerned for this great work that will transform the health status of women and children. Ladies and gentlemen, over the past decade, Tanzania has made significant progress in reduction of under 5 and infant mortality rate to 81 per 1,000 live births and 51 per 1,000 live births in 2010, respectively. There is a 45 reduction in under 5 mortality rate and a 49 reduction in infant mortality compared to the data of 1999. However, less progress has been achieved for reduction of newborn mortality and maternal mortality. We are therefore intensifying our effort in addressing these areas. Tanzania has been a close partner of the Every Woman, Every Child movement, and His Excellency Jakaya Mrisho Kikwete, President of Tanzania, is among the global leaders advocating for MDG 4 and 5. Tanzania is fully committed to improve maternal and child health at the highest political level. You may recall, Tanzania was privileged to co-chair the UN Commission on Information and Accountability for Women's and Children's Health. This is therefore forms the foundation to to hold ourselves accountable in this endeavor. Honorable Chair, we are committed to implement the recommendation of the Commission, especially recommendations 6, 7, 8, and 9. To strengthen supply and awareness, we commit to roll out electronic logistic management information system, linking it up with mobile technology. We will undertake efforts to increase demand for and utilization of health services and products with targeted behavioral change communication, particularly among the underprivileged population. For family planning in particular, we commit to scale up an outreach initiative. We will continue to promote innovative health financing mechanisms, including the use of community health financing, national insurance financing, and cost-sharing funds, earmarking them for the commodities at facility level. We shall continue to update national guidelines and build capacity of providers on use of various commodities, especially implants, oxytocin, magnesium sulfate, newborn resuscitation, and pneumonia and diarrhea management. Honorable Chairperson, Tanzania shall also put systems in place to strengthen monitoring of these life-saving commodities and the accompanying recommendation. Among other reproductive and child health commodity security committees shall be strengthened. Finally, we acknowledge and appreciate all the support from development partners and call upon partners for continued investment in reproductive, maternal, newborn, and child health interventions. Distinguished dwellers, it is our belief that together we shall create a positive change for the lives of our women and children, which are the leaders of tomorrow. Thank you very much.
Our sincere greetings to the government and the people of the federal government of Nigeria, and to express our gratitude for the invitation to this meeting. We as a country recognize the importance of the meeting in heightening the significant role the 13 commodities can have in reducing maternal and newborn mortality if pursued in a systematic and consistent manner. As a country, our current statistics show that we have 90 deaths out of 1,000 for the children under 5 years, and maternal mortality stands at 438 per 100,000. And our target is to reduce this by 2/3, that is by the year 2015. We also recognize the challenges that we have in realizing our objectives, and majorly these are the human resources for health, shaping our delivery markets, awareness creation, and coordination between the public and the private sector players. Session Chair and my colleagues, Uganda is committed to address these challenges, and this financial year, the health budget has been increased, and this is going to be done annually. In particular, we have immediately embarked on the recruitment and deployment of critical health cadres in the delivery of maternal, newborn, and child health. We are also introducing the pneumococcal vaccine in the year 2013, and we hope this will help reduce on the child mortality. Strengthen local delivery mechanisms by leveraging the potential synergies that can be gained from partnership between the public, private sector supply and chains. We shall revitalize awareness creation campaigns that target both providers and the communities to optimize access to accurate information and commodities for better maternal and newborn health. We also commit to strengthen accountability mechanisms to ensure efficient use of the limited resources available locally and those from the development partners. We shall ensure that maternal and perinatal death reviews is functioning at the community, district, and national levels. Allow me on behalf of the Ugandan delegation to thank the organizers of this meeting for the excellent meeting and the UN Commission on the Life-Saving Commodities for Women and Children for the enormous task that they have embarked on. We commit to work with you throughout the journey, and together we shall achieve the set objectives. And I want to end with a quote by Mahatma Gandhi, that be the change that you want to see in the world. Thank you very much for listening to me.
Thank you very much indeed, including for the wonderful quote from Mahatma Gandhi. Sir, I believe... Oh, Senegal. Ah, sensational. Sensational Senegal. Please, sir, and my humble apologies.
Merci, Madame le Président. C'est moi qui n'ai pas pris ma place à ce niveau, c'est pourquoi vous n'avez pas vu. Madame la Présidente, Mesdames, Messieurs, les représentants des différents ministères, chers participants, le Sénégal actuellement a un taux de mortalité maternelle de 392 pour 100 000 naissances vivantes. Il a aussi 72 pour 1000 décès pour la mortalité infanto-juvénile. Donc pour montrer que nous avons encore du chemin à faire d'ici 2015. Nous avons au pays développé un plan de passage à l'échelle pour les interventions à haut risque pour relever et diminuer la mortalité maternelle et la mortalité infanto-juvénile. Nous avons participé à Londres au sommet pour la planification familiale et le Sénégal s'est engagé à multiplier par 5 même, parce qu'on a déjà doublé le budget, on voudrait multiplier par 5 le budget qui a été prévu pour la planification familiale. Nous avons, il y a environ 1 mois, élevé la santé de la reproduction et la survie de l'enfant en direction, parce que ce secteur n'était qu'une division dans la direction de la santé. Maintenant, c'est une direction de la santé, de la reproduction et de la survie de l'enfant. Nous remercions le Nigeria de nous avoir invités à cette réunion. Cette réunion nous a permis de voir que nous pouvons accélérer tout ce qu'on devrait faire d'ici 2015 pour la santé de la mère et de l'enfant, surtout avec les 10 recommandations qui ont été proposées et aussi les 10 produits essentiels que nous avons à mettre un plan d'action pour d'ici 2015. Je remercie encore une fois la Commission des Nations Unies qui a pu se réunir avec donc, la Norvège comme président et vice-président comme le Nigeria, de nous avoir vraiment invités à cette rencontre qui nous permettra, malgré ce que nous avons déjà fait, de pouvoir accélérer l'atteinte des objectifs du millénaire, surtout l'objectif 4 et l'objectif 5 d'ici 2015. Au nom de Madame le ministre de la Santé et de l'Action sociale, Awa Marie Coll Seck, nous signerons la déclaration ministérielle qui a été préparée, que nous avons pu lire tout à l'heure. On a pu corriger et participer, contribuer à la traduction française. Nous allons signer effectivement cette déclaration des ministres de la Santé pour que d'ici 2015, qu'on puisse sauver des vies Je n'ai pas encore le chiffre, mais déjà le Nigeria a parlé de 1 million. Nous, on va essayer donc d'atteindre le maximum pour pouvoir donc satisfaire à la santé de la femme et de l'enfant. Je vous remercie.
Merci beaucoup et je suis désolée. D'accord. I think I am nearly safe, sir, to hand over to you now as Minister for Health of Nigeria to report to us on Nigeria's progress and commitment. Thank you.
Thank you, Madam Chairs, Honorable Ministers, Excellencies, distinguished participants, good afternoon. I read these commitments on behalf of the government of Nigeria that we commit to prioritizing saving the lives of women and children within the context of the overall government's transformation agenda and the ongoing effort to save 1 million lives from now until 2015 is indeed achievable. Within the initiative that has been rolled out for saving 1 million lives, the recommendations of the Commission are fully embedded within the various strands of the Saving 1 Million Lives initiative. We're committing to expanding the midwifery service scheme, to enhancing the community health worker, village health worker deployment across several parts of our, particularly rural areas in our country, enhancing logistics and supply chain management for essential commodities, such as oxytocin, magnesium sulfate, misoprostol, zinc ORS for diarrheal diseases, chlorhexidine for neonatal sepsis, for prevention of neonatal sepsis. In particular, we're aware of the significant effort of some of our states. For example, Sokoto State is working with the US government to start, in collaboration with the private sector player, packaging chlorhexidine for newborn cord care. We're committing to innovative use of technologies such as mobile telephones to fast-track access to information, to improve governance within the sector, and to empower providers of healthcare, as we're already doing through the midwifery service scheme. We're committing to continue to expand the innovative financing efforts that have been laid out already in our country. The community-based health insurance, the free MNCH